Hello, welcome to the Perch Dissection. To start off, we're just going to go over some exterior anatomy so you understand what you're looking at when you're just examining the outside of your perch. For starters, we'll look at the fins. We have the caudal fin, which is the main one in the back. We have the adipose fin, which is sort of like the more posterior end of the dorsal fins. There's two fins in the back. A lot of people sort of mistake this for one big dorsal fin. This one with the thicker spines on the inside of it is the dorsal fin. This is the adipose fin in between the dorsal fin and the caudal fin. This is the pectoral fin on the side of the fish. Then down here we have the pelvic fins. There's two of these. And the anal fin behind that, behind the anal pore, which is actually where we're going to begin our dissection when we're making our window cut in the perch. A few other things to look at. You can see the lateral line in your perch. It's part of their nervous system, actually. That'll act as a guide for us. That's about as far up as you want to cut when you're cutting through the perch's body. You don't have to worry about getting into the really meaty upper part. If you just follow the lateral line down and then cut back. Another thing you can see on the exterior is the operculum. This is the gill cover. We'll not be cutting through this because it's very, very hard, but that'll sort of be a stop for you of like where to cut down through the perch. Of course, you want to examine the eyes and the mouth. They do have very fine teeth, so you can actually put your finger in there and you can feel it grab the gloves. It's very fine, almost like sandpaper with their teeth. To start the actual dissection, what you'll need is your large pair of dissecting scissors. These should have sort of a pointed end and then a blunt end. What we'll start with is the pointed end. You actually insert the pointed end into the anal pore. Begin cutting up the side. We're going to cut across the top just along the lateral line. Then we're going to cut down once you get to the operculum or the gill cover. Then we'll cut across the bottom and begin to fold that flap up on the perch. This does take a little while, so you just want to take your time and you want to try to keep your cuts as shallow as possible because the organs of the perch are just on the other side here. They have cartilaginous ribs reaching down from the side that you will feel, and you may crunch through some of those. That's okay. Also, some of their scales tend to sort of go flying. That's just the way it goes. So try to contain everything inside your dissecting tray as much as possible. Definitely orient the fish in order to make your task a little bit more comfortable. So you see I sort of turned him around here. I'm assuming it's a him. We'll see. It's one of the bigger ones. So the gill cover, the operculum, is right here. So we're going to cut down just on the inside of that. If you nip off a bit of the gill cover, that's okay. This is where they really start to get sort of thick and their skin gets tough. So you can cutting through the, there we go, through his pectoral fin. Now, when you're cutting across the bottom, you want to make sure you keep things very shallow. They're actually not very thick on the bottom. There's not that much to them, so it's easy to cut through and hit some of the organs on the other side. When you're cutting through where the pelvic fins are, that area can get a little thick. But then, once you're through there, it's pretty much clear sailing. So now, we have completed it's called a window cut. So this is very unlike if you're fishing and you're just like gutting a fish. But we have the cut all the way around. What you typically want to try to do here is to begin peeling this back. And the trick here is just to see where you're getting resistance. Anywhere you're getting resistance is an area you still have to cut. So for example, you can see like this area is not really opening for me. So what I have to do then is get in there and cut a little bit deeper. There we go. So now, again in this corner, I'm getting some resistance. So I'm going to cut a little bit deeper. Try not to cut any deeper than you have to, because remember, again, the organs are just on the other side. So the trick is just pull a little bit, and if you're getting some resistance, just cut a little bit more into some of the muscle of the perch. And depending on your perch, you may not need to cut quite as high. That's what I'm looking at now. I'm trying to see the body cavity, because they're very muscular up here at the top, and there actually are not any organs under some of that muscle. The swim bladder is going to be the highest organ on the inside of the perch. So once you can see the swim bladder, which is what I was looking for, then you can potentially finish your cut. Just go straight across. So what I'll do is at least get this out of the way so I can see a little bit better by cutting across through here. You can see the organs now on the other side. The trick to this is really just to try not to rip or tear anything. Cut everything that you have to, and you'll really see how thick and muscular the perch is. I think of the 3 dissections we do between the perch and then the rat and the squid, the perch is easily the most physically challenging, just because the part of their body that we're cutting through is so heavily muscled that it's difficult to get some of this tissue to come off. I'm actually going to try to use scalpel a little bit here. Let's see if that'll help me. Always want to keep your hands well away from wherever you're cutting. See, my left hand is well away from where this is cutting through the perch here. There we go. Alright, and this will be good enough for us to see most of the internal organs. Okay, I just want to show you what I did here off camera. I stopped things so I could remove this portion of, put this on the right way, this portion of the perch. I cut away this section here to allow you to see the organs a little bit better. Just in an effort of keeping the video short, I sort of edited out that step, but if you cut around the outside carefully, being careful to be shallow, this will allow you to sort of expose the inner portions of the perch. For starters, the yellow masses here show us that this guy is male. The other thing to point out is the liver. The liver's here. Now what I'm doing for this specimen, this is actually one of the fish that are left over from last year. Typically the liver is much better preserved than this. It's typically sort of here in the front, covering up the stomach and a few of the other organs. The stomach is here. I actually perforated a little bit of that when I was making this cut around the outside. If you do that as well, that's okay. The stomach connects to the intestines on the inside. So you can see part of the intestines here. The pyloric cecum is, if we get this out of the way, the pyloric cecum is this bit that connects from the stomach into the intestines, so it's sort of thin and fibrous. If we move some of the other organs out of the way here, this is the swim bladder. It's still intact. Many times people end up actually cutting through the swim bladder as they're making their cut along the top. If you try hard to keep things nice and shallow, you should still see this one. And this is actually one of the things I was looking for when I held that flap of the muscle out of the way. I was looking under there in the beginning to decide if I had cut high enough, and there's no need to cut any higher than this because the swim bladder is the highest organ that we're identifying. The final steps are to get to the gills and the heart. The gills are beneath the operculum. There's two ways to do this. One way is to just cut through the operculum. The other way is to continue cutting this way through the bottom portion of the fish's head, and you can see the gills on the other side there. What I'm going to do for the sake of time in this video is just sort of hold this one back. You can see as I hold the operculum back that the gills are just on the other side. So we sort of hold that apart. The gills are right here. They're very thin and almost feather-like. Remember, that increases their surface area. That allows the fish to take more dissolved oxygen out of the water. The heart is basically directly on the other side of these. So if you remove the operculum, remove the gills, and then continue in this direction, you'll be able to find the heart of your perch. You could also, as I said, go this way, trying to make sure you maintain very shallow cuts. Remember, if you cut too deep, the odds of you cutting through some of those organs we're trying to identify is certainly a problem. Something I forgot to say in the beginning, just the general anatomical ends. I should have mentioned this when I was going through the fins. The anterior end, the posterior end, the dorsal end with the dorsal fin, and then where we're making all of our cuts, which is on the ventral end over near the stomach. So again, if you make that extra cut on the other side, it definitely opens things up and allows you to see the organs much better. I'll be very impressed if you get the swim bladder out intact, because that's one that's very, very easy to perforate. It's easy to cut through. So as you're finding these organs, remember you want to remove them, put them on your identification sheet on your desk. That way, as I'm walking by, I can see what you found so far. Just take your time with the perch. The biggest thing is just to make sure you're following the steps, and make sure if you have any questions that you ask, because I'd rather have you ask me 100 questions than to go through and make a mistake. So as always, when you're finished or having respect for the specimens, make sure you get them all back in the morgue in the front of the classroom, and we'll take care of things from there. So as always, I appreciate you guys taking the time to watch. Make sure you answer the questions that are at the end of this video. Thank you.